lowering your risk of a medical crisis or emergency like an aneurysm is the goal behind specific technology being used at hospitals nationwide and at OSF St. Anthony Medical Center in Rockford. WIFR reporter Alyssa Kelly talks with medical experts about artificial intelligence and its potential role in saving lives.
Doctors tell me aneurysms, which happen when a blood vessel bulges or balloons, are usually fatal if they break open. And even if you get to the hospital fast, only about 10% of patients survive.
So we want to do everything we can to limit that patient's potential of having a rupture.
With high patient mortality rates from aneurysms, doctors at OSF Healthcare hope an artificial intelligence program will save lives.
What we're doing is looking at all of our imaging studies that have been completed for patients, and if there's ever been an incidental mention of an aneurysm, we're capturing that via the dictation from the radiologist or the person reading the study, and then the computer generates a list of these patients.
OSF doctor Samantha Cox says AI allows experts to dig deeper into a patient's chart and alert them to any red flags, warning signs of a potential aneurysm.
What we're trying to utilize this technology, which as you mentioned can be scary for some people, we're trying to use it in a very positive way.
Similar technology is already used to identify a patient's risk for cancer or monitor tumors within their body.
I think in the sense of our healthcare world, using this technology for a patient's greater good is really going to give us cutting edge research, cutting edge data.
But experts emphasize AI isn't a replacement for doctors or nurses. It is added support and helps patients and their physicians make the best decisions.
We're going to be letting the patient know that we're using that tool. Across the board, we want transparency that where the tools are being used and impacting things.
Several patients at OSF Healthcare already benefited from the technology being brought back to clinics to help lessen their risk of an aneurysm.
Cox says one of the greatest points of success is that it has fostered new relationships with primary provider offices, furthering patient care.